Welcome back to another episode of the Nursing Now podcast. I'm your host, Chanel McSwiggan, and I'm here with Rachell Dumas, and she owns the company A Light After Nine. She has a really beautiful message and a really cool, over-encompassing company. I was really excited to have her on because I think that this fascinating nurse took something that was so close to her heart and built on it and is making a really successful one business, but two impact in the world. So I'm really excited to have her on. Rochelle, thank you so much for taking the time to come on my podcast today.
Thank you for having me. I really appreciate it.
Yeah, no problem. So I think that the nurse business owners can explain their business model way better than I ever can. So can you tell me a little bit about A Light After Nine?
Yeah, absolutely. So I started a light after nine after my very, very traumatic pregnancy journey. And I had issues with access to maternal care. And I live in Atlanta, like a really big city. That shouldn't be, right? Shouldn't. I also had issues just with finding mental health resources, payment for the amount of losses, and just a lot of issues, and really needed a lot of resources throughout that journey and advocacy that I did not have. So I started Light After Nine to help other women, birthers, and families through that process as well, so they wouldn't have to suffer the same issues that I did.
Yeah, that is so beautiful. And I'll say I'm so like honored that more and more strong women are coming out and sharing their story because I have so many friends that are starting to become such strong advocates in this space that I didn't see 10 or 20 years ago. My mother miscarried, and that is something we never spoke about in my family, but it impacted her for the rest of her life. So to see such strong women starting to really take back like that movement and to provide such comprehensive like resources is a really beautiful time to be alive.
Yeah,
Um,
it means so much because when you're vulnerable enough to have that conversation, you instill that vulnerability into other people. I had an aunt who had seven stillbirth, I mean, full term babies. So when she told me that, it did give me some power to tell my story.
yeah, I think it definitely snowballs. And there's so much strength in that and vulnerability in that. So again, thank you for doing really important work on this. So, your whole thing is that you fight like healthcare disparities, which is such an integral part of nursing, and you address issues for women of color, which I mean is such a big issue too. I've seen so many statistics about women of color being unsafe when they're having their babies and the complications that can arise, which for a woman not of color is so baffling to me and heartbreaking that these racial disparities still exist. Like, I believe that they still exist. It just is so heartbreaking that in the United States, in the modern times, that people somehow are still slipping through the cracks and that like the maternal death rates are really high. And that's supposed to be such a special and beautiful time with those mothers. So that's really awesome that you're a woman of color really coming into this with such like a force and beauty to you.
Yeah, absolutely. It's a lot going on that we need to address, and it really takes a village. So telling that story, also advocating, and then fighting this good fight is crucial.
Yeah, no, it really, really is. And I think like more awareness is needed before we can even like start to solve the problem.
Yeah.
Because like I said, I was not even aware as someone that is not of color. My experience is so much different than anyone else's that is of color. So I mean, I'm ignorant unless I'm told otherwise. So even like speaking about it is like the first step to that. So you're a nonprofit organization and you support women and families navigating the emotional as well as the physical challenge for like infertility and pregnancy loss. And I did a lot of research on your website, which was really beautifully done for anyone that's curious. It's a really good resource. It can connect you to a lot of other resources as well. One of the things that you guys do is grants,
Mhm.
outside grants, and I saw that you were working on providing maybe your own grant down the line.
Absolutely. We are. working on providing our own grants. So we're looking for funding and working on getting funding. But we do make sure you are very much aware of all the other grants. There's so many, and people just don't know, including myself. I did not know about all of these fertility grants that I could have used because the amount of bills that I have from the hospital is just ridiculous. But we're also working on our own scholarship, which I will be providing within the next few days. I will be dropping that for those who are pursuing careers in maternal health because it's a shortage there too. And we really need people, or else how are we going to fight this crisis and get the treatment that we need?
Absolutely. I thought it was really interesting. One of the grant also includes adoption. So I thought that that
Yeah.
was really cool too. That you're like so over encompassing, not just like infertility and pregnancy loss, but also adoption. So it's really cool to see you just covering a whole wide range of populations.
Yeah, so adoption is still a part of our pregnancy journey if we choose to go that route. Sometimes us being pregnant naturally or on our own is a life or death situation, which if I was to get pregnant again, it will be a life or death situation, unfortunately, because of the aftermath of my journey. So we have to make sure our members know about all options, and that is still part of your pregnancy journey.
Of course. Thank you for telling me how it ties in. Yeah. So you also provide like educational resources. I was seeing like workshops, and topics like reporting unsafe situations in hospitals, which is huge because again, we can't fix what we don't know. Emotional resilience after loss, which is such a big one as well, and finding like reproductive specialists. So, and I think I saw a picture from one of your workshops. It looked like really, really happy and enlightening. Like everyone was like just really smiling and having a blast. Like it looks like a cool place that people would want to go and be a part of. So it seems like you're also building a really fun community around you because I feel like a lot of this is also like community and seeing yourself in those people around you.
Yes, the maternal health community is so small and big at the same time, and there's so many different type of issues that you can have throughout this journey, and it's just nice to have somebody who is going through that struggle and just to talk to. So one of our initiatives is the mom to mom mentorship, where you are paired with another mom, and you can talk about that journey. Ideally, it's a mom who's been there, done that type of situation, or it could be a mom that you want who is going through that same struggle and you guys can hold hands walking along that journey too. So it's we do a lot. And then as far as advocacy, I'm making sure I educate these members on how to advocate for themselves. There were so many times, and I'm a nurse, right? I'm a trauma nurse. I'm an OR educator, all these things. But when I started my pregnancy journey, I had no experience with maternal health, so I couldn't advocate for myself because I didn't have the education. So we're making sure that these members have the education they need to speak up for themselves.
Yeah, it's a totally different like specialty, like a totally different animal. I'm a medical writer
Yeah.
and I've written on labor and delivery and maternity, and it takes me so much longer than any other type of deliverable just because it doesn't like translate the same way, and the amount of research that goes into it, like it's its own thing. So yeah, the advocacy is completely different. I do want to go into your
Yeah.
nursing background because forgive me if I'm wrong, but I don't think you have a labor and delivery background, right?
I started my nursing career in trauma at a level one trauma center in Atlanta, one of the big ones called Grady. And I floated around to neuro ICU, medical ICU. I can save any life any type of way. And then I went into education, or I'm actually just finished the coursework for my master's in nursing informatics. So when I tell you far away from maternal care is possible, I just was very ignorant to the specialty outside of nursing school, which we know as nurses, once you pass that class, it kind of goes out of your mind unless you're going into that specialty. So when I went through this pregnancy journey, I almost became an expert. That's how much research and advocacy I had to do because my journey is just so dynamic, unfortunately. So I had to do a lot of certifications to just to be more well versed in this community, and it served me well. And the community is so receptive of my business.
Yeah. So congrats on your finishing up your master's in nursing informatics. That is huge. I have my master's too. I know what of a brain drain that
Yes.
is. So
Yes.
congrats. Let's take a second for that.
Yes.
And also I love when nurses are building on this super exciting business venture without having like a bedside clinical experience with it, like you haven't worked for years with that, or that they don't have like a master's in that certain niche. Because I think it really shows nurses listening that you can take a passion and a personal experience and you can kind of blend that with your nursing ability to research, knowing like client advocacy and all of those different aspects. So that's just why I ask. I always love when nurses aren't limited by like their clinical experiences and they just think outside of the box and they just know how capable they are. So it's like beautiful that you were able to like see that career path without pigeonholing yourself.
Yeah, absolutely.
Yeah, yeah, I love that. That's
So I
one of my
uh,
favorite things. Um,
I think just going into it from a different perspective can lead to a lot of innovation, right? Because it's different from being, the patient. And then I have that perspective from nurse and patient. So from a patient perspective, I know about patient advocacy. Unfortunately, I had to report a lot of mistreatment and false documentation and just a lot that could have cost me my life and definitely cost my baby's lives. So I think when I'm going to, because I have that experience, I'm able to go into it with all of these thoughts and ideas of how we can reinvent that wheel that needs to be reinvented.
I agree. There is some like crossover with medical writing too, where people are really excited that I have that nurse background because I see things just like in a different way. It's kind of like
Yes.
your superpower, like ability to do that. So I always like remind people that you're not leaving your clinical background, you're not leaving becoming a nurse. You're just like taking all of your nurse knowledge and you're just putting a new fun spin on it to support like a different
Yeah.
population that you didn't support at the bedside. Um, so tell me a little bit about what sparked this in you. I think you alluded to it. You had a really bad experience at the bedside and you saw a need there and you turned that need into a business. Can you kind of tell us about that for nurses that might be wondering what they can do to like identify a need and turn that into a business?
Yeah, absolutely. So it's very difficult to tell you how I got to my business while really telling my story. So in 2018, I had my first pregnancy loss, and that doctor said everything will go fine. This is part of your pregnancy journey. It happens. You're going to have a baby. And I believed him because, like I said, I didn't have a maternal health background. I got pregnant in 2020 and I found out I had twins. And I started bleeding. So I went to the ER. They told me to follow up with the OB. And I was in that office 2 or 3 times a week. It was just so bad. I had bleeding, pain. It was just horrible. They kept reassuring me that everything was okay, despite of my symptoms. I ended up losing that baby at 13 weeks. I was still hopeful. I had another baby still, and my symptoms resolved, and I was feeling great enough to allow my friends to plan my gender reveal. They did so, and on the day of my gender reveal, I went to the bathroom, and the baby fell out. So I was devastated, and that was the turning point for me, where I was thinking, that doctor, he didn't know what he was talking about. Like this, I have a problem, and I don't know what it is. So I went to the ER, went to the OB, and she diagnosed me with cervical insufficiency, which is my cervix is too weak to hold a baby on its own, and I need a stitch, a suture around it to keep the cervix closed so I can carry the baby full term. That has happened at 13 weeks. I had multiple miscarriages after that. And then 2021, April, I finally got pregnant again, saw a reproductive endocrinologist and a reproductive geneticist to make sure there was no genetic issues causing these miscarriages, which there were. And the reproductive endocrinologist prescribed me a hormone to keep me pregnant because I also was having early losses. So I can make it to the 13 weeks to get the procedure. I made it to the 13 weeks, got the procedure. She said, come back at 20 weeks. 7 weeks is a long time for somebody who had like 5 or 6 miscarriages. But I begged her to allow me to come in between that time. She said no, and I believed her. She said, you will for sure know if it fails, if your cerclage fails. It will be painful, there will be bleeding. So for 7 weeks, there was no pain or bleeding, and I went into that OB's office excited, into the maternal fetal specialist office excited, and she came in and said, your cerclage failed. You can go and give birth. very nonchalantly. And I asked her, I was like, we can't do anything, do another surgery, put another cerclage in. We need to do some research, something. She's like, no, you can give birth. Very nonchalantly. I said, I'm going to fight for this pregnancy. I'm 20 weeks. It's the longest I've been pregnant. So my whole village called all the doctors in the United States, literally, that could possibly do another cerclage on top of it. And we found Dr. Fogwell in Dallas. He asked me to fly there, and he said, we'll get it done. He had previously saved a 20-week pregnancy with twins who had the same issue. That 3-hour surgery turned into 8 hours, but I woke up surrounded by healthcare professionals cheering me on, saying we're still pregnant. It worked. But then anesthesia wore off, and I went into labor for 30 hours. And then my water broke. And I had to go back to the OR, take both of the cerclages out, and I held my baby as he passed. That was definitely the lowest point, but he promised to bring me back out outside of pregnancy and redo the cerclage. And that November, true to his word, he did redo the cerclage. In May of the next year, 2022, after multiple early miscarriages again, I found I was pregnant, went to the reproductive endocrinologist, graduated to the maternal fetal specialist, made it to the 3rd trimester, and on December 30th, 2022, I finally had my baby. So all of that is the reason that I started Light After 9, because after 9 losses, I finally got my light.
Wow. Thank you for sharing your story. I can't begin to imagine how hard that is to relive those words and that trauma. And, thank you so much. And thank you for doing the work that you're doing for everyone everywhere so that they know that they're not alone and they have the resources and they know how to begin to navigate that story. And I just want to point out that how complicated the
Yes.
journey to motherhood can be. You turn one
Yes.
corner and you think you're on the upswing and you're just declining again and you turn another corner and there's more surprises, which is what I've heard from other people too. So it just goes to show you again how incredibly valuable your resources are and why people need these grants, they need these workshops, they need these educations, they need that community because as someone who has never experienced this, I can only hear another person's story and
Yeah.
sympathize with them and to a certain degree empathize, but I can't get it on that deep level. So it really shows how important it is that someone who has experienced this created a business and is running this business. So thank you so much for sharing your story and for coming on and letting other people know that they can make a beautiful thing out of such a traumatic experience. So thank you so much for that. So, for someone that wants to make a difference as impactful as yours, and they see a need around them and they want to help people in the way that you're helping people, but they're just not quite sure where to start. Do you have any of the first few steps? How did you get started? Do you have any of those tips that you can share the people listening today?
Yeah. For people who are not trying to start a business, start at home. If you have someone who you are trying to go through that process with, take care of them. This you would love to think that when you start the conception process, it'll just be smooth sailing. You just do not know. Do your research. Make sure you have that education in your mind just in case something happens as much as possible, because pregnancy is not as cookie cutter as we would like to think. And then nurses, if you're trying to become an entrepreneur and move into that space from the bedside, I know it can seem intimidating. I know. And I know the burnout is real, especially after COVID. It's just we were tired. I'm still tired from COVID. But to be honest, but I just want to say to just go and do it. Honestly, it's just that simple. You will make mistakes along the way. It's going to happen. Pinky Cole has the owner of Slutty Vegan. She has this book called "I Hope You Fail," and she beautifully says, and it gives example of so many ways that she failed and how she learned from it. Don't be afraid of that process. Go into entrepreneurship. That idea, that intuition that you have, it's there for a reason. Really do it. There are a lot of resources out here for starting a business, and so many coaches who are just really, really great at coaching you through this process. Reach out to those people. They're knowledgeable. They're there for a reason. But whatever you do, start that business.
I couldn't agree more. I was really overwhelmed when I started my business. Like I just felt like
Mhm.
my world was spinning all the time. Like, how do I do a
Yeah.
website? How do I even talk to people? Like, how do I hone in on what I'm doing? And then what really helped for me was focusing on one thing on that one day and just checking off that list one by one. I like how
Yeah.
you mentioned the failures. I'll say that my failures, even when I stumbled and made a failure, I didn't stumble all the way to like my
Yeah.
ground zero building blocks. You know what I mean? Like I
Right.
still made progress. So if you're scared of
Right.
failure, one, there are beautiful lessons that you can learn in everything. And two, it's not like you're falling all the way down to the bottom of the hill. Like you're still in a really good spot. And it's like an invigorating type of thing where you're learning as you go. So failure isn't always like the worst thing. Like you said, that book, I Hope You Fail, sounds like a really
Yeah.
good resource and like it can speak to that. So thank you for that too. Um,
Yeah. You need to expect failure, honestly. Just really expect and embrace yourself for failure. If you're not doing it, you're not doing it right, to be honest. That means you're not learning and find the beauty in that, truly. Your biggest failure is if you don't try to do it. And that should that should be where your bar is set. If I didn't do it, I would be a miserable failure at this point.
Oh my gosh. Yes. If I didn't have my business, I would be so sad. Oh my gosh. I don't even know what I would be doing. I would be so burnt out. I would probably have no friends. Like, because I've made so many friends on this journey too, so many beautiful like
Yes, so many.
experiences. Yes. Oh my gosh. Yeah, I don't even want to think about that. What's your best advice for someone listening that wants to do something similar in their business? So maybe they want to provide like advocacy in like a different space, or they want in to get into like researching grant things, or they just want to do like workshops that really like heal the soul. Do you have any tips for people that are thinking about doing that?
Yeah, absolutely. So in 2024, you definitely have to build that platform, right? You can't do a lot of things with just 10 followers. You have to build your platform, build your credibility. So be an expert if you can, or definitely a student of the trade. Do your research, talk to people, network. I mean, that's literally my favorite part of entrepreneurship. Is like you said, all the amazing people that you meet, they have connected me with other people. They have like I've had so many connections who are like, oh, you need to talk to this person. That person's like, you need to talk to this person. Y'all need to meet, be a part of this organization. And then I do it. And then I follow up and it works out. And then you also have to really truly believe in yourself. It is, that deep too, to have that true belief that what you're doing matters and just keep that along the way. But also building your platform, going on podcasts, getting in the media, writing, your articles about your business and yourself, following people on LinkedIn and following up with them, asking for advice, partnering. Another thing I love is partnering with other maternal health or whatever your specialty is. Partnering with like-minded organizations is amazing. You meet so many people that way, and they're lifting you up, especially if they're already there, like March of Dimes, some Moz, PSI. They're already there and have that widespread. So when I talk to them, they're like, yeah, we got you. We'll put you on here, here, here. You need to be in this space. And then I get in these spaces and then I'm able to help others. So it just works like that.
Yeah, I think the overarching thing that I'm hearing is networking and saying yes
Yeah.
and putting yourself out there, which I don't think I understood until it was happening to me either.
Yeah.
Like just saying like, "Hi, I'm Janelle. How's your day going? Like, how
Yeah.
are you? What's up with you? What do you like to do?" And then people would connect me with other people and just open a door that I didn't even know existed. I feel like it was like a secret trap door, or like a wall that you knocked three times and suddenly it appeared and there's all these people like in a speakeasy chatting and they're super successful.
Yes.
They're like, come on in, let's hang out. And I'm like, this wasn't here before until I like did the
Right.
secret code to knock. Um, so yeah,
But now that was
definitely.
like, that's a
Yeah, no, it's wild. Definitely networking. Definitely coming on podcasts. I'm also always going on podcasts and meeting other people too. Getting your name out there. Like you said, the collaboration. I'm doing a lot of that as well. How can I help you? One of the things I always like end like an email with or any sort of interaction, I'm always like, let me know how I can help you. Let me know how I support you. I'm a huge proponent of nurses, healthcare workers, but just people in general. If there's something that like I can do for you, let me know. And then not even meaning to like have this happen, people have messaged me randomly out of nowhere because I've made like a post like let me know how I can help. And they've been like, I saw that post, let me help you. And I was like, oh, I was not even expecting this. So, like, what you give into the universe is like also what you get. So, if you like foster that collaboration, like, it's going to definitely come your way through one route or the other. So, absolutely, networking is a huge thing. Even if you're unsure of what you're doing, just like you
Yeah.
mentioned, talking to those titans in your industry that you might want to like maybe go into can give you a ton of ideas on what they're doing and where you can go. So yeah, those are all amazing tips. Thank you so much for that. Okay, so Rochelle, do you have anything that you want to share with my listeners? Any parting words or anything like that?
Yeah, I just want to say that you should remain as encouraged as possible going into entrepreneurship and stepping away from the bedside. It's daunting, it's scary, it's all of the things, but it's also exhilarating. It's exciting to see the seeds that you sow like really blossom. So stick with it, do the thing, be brave, and it'll work out for you.
I couldn't agree more. I love seeing where my business has gone. I looked back on like my course offering and I was like, oh, I've only
Mm-hmm.
offered this thing for like a year and a half. I feel like I've offered this for like 4 years. And my husband was like, no, it was only like a year and a half. So it's crazy where the time goes. And I couldn't imagine my life without this. And I couldn't imagine my life without trying to build the best materials that I could to support the people around me. Once you get into it, you're like hooked. It's like,
You
I
are,
don't know, like being on your phone and scrolling all the time. You're just
yeah.
like, I love entrepreneurship. It's like scrolling on your phone. Like you get that dopamine hit when you do something right and you're like, oh, I love this.
That obsession of getting great emails and feedback and having these conversations. It's an obsession. It's like, man, I'm doing this. I'm making a big difference and I'm walking in my purpose. It's
Yes.
amazing.
Oh, yes. Especially you are. Well, Rachell Dumas, Dumas. I'm going to redo that again. Rachell Dumas, thank you so much for enlightening us with your inspiring story and all of the work that you're doing out here. It was such an honor to have you on here. And I think that you are just such an inspiration for nurses out there who aren't quite sure what they want to do, but maybe they had an experience that they want to work off of or they want to make a difference in the world. So just hats off to you and what you're doing. Her website is A Light After Nine. Everything will be in the show notes. So thank you so much for joining me again.
Thank you so much. And Janelle, you're doing amazing things. Like I'm so proud of you and so inspired by you. Seriously.
Oh, thank you so much. Thank you. All right, guys, that's all the time we have for today. Bye. Okay.